So early on in my career as a care manager, I had a very challenging client that I worked with. This was a lady who lived alone. Her husband had passed away. She had no children, and she had one nephew, but he lived out of the area. They had always had a friendly relationship, but he wasn't very involved in her day-to-day life, so he would come visit. And he did have power of attorney, but it was not yet activated, and no physician had said that she was incompetent or unable to make decisions. As time went on, she had symptoms of dementia. She was eventually diagnosed with Alzheimer's, and she started doing things that were causing concern with the neighbors. So eventually I got a call from social services, and they asked that myself and the nephew, the neighbor, and her elder law attorney come in to meet with them. And we devised a plan to try to get her some help in her home. She continued to resist care. She would not let me in the door. She would not talk to me on the phone. She did not see that there were any problems or concerns for safety, and she just did not want the help. So we continued for a few weeks trying to build a relationship, but as she continued to resist care and as she continued to have safety issues, showing up at the neighbors, confused where she was, showing up at church choir practice on the wrong nights, hitting mailboxes, she backed into a car, more and more people were concerned. And so eventually she was taken to our local hospital and she was evaluated by the behavioral services team. At that time, she was placed into a psychiatric care unit for 1 week, and the terms of her release were that she would have care management implemented routinely and that she also would have caregivers put in place so that she wasn't alone to begin with at night. So I started my routine weekly visits. We would sort the mail, we would forward bills to the nephew, who now had full power of attorney privileges, make sure she had food to eat, make sure that the medications were being taken correctly, would go to physician's appointments with her, and sort of keep the plan of care and the team informed of changes in her life. She continued to be resistant. Some days she would let me in the door easily. Other days she would slam the door in my face or call me names. So I learned little tricks to sort of get in the door. I would bring treats with me or prompts that might have her come outside to meet me, and then we would sort of walk in the house together, and that seemed to work. So over time, she became very resentful. She became very angry. She wanted to be in her home, but she certainly didn't want all these people there with her. But we continued on. And eventually that routine became a comfort to her, and she depended on me being there every week. And as her communication skills declined and she wasn't able to communicate her needs or wants, she began to trust and look forward to our visits because she knew that we had built up enough of a relationship that I was there to help her. So we continued over time, and as she declined and as she could no longer communicate, the look in her eye was compassion, was love, was gratefulness. And so there was a shift in our relationship from someone that she feared and that she felt was taking her independence to someone that she knew was there to help her. We kept care with her for 8 years. Eventually she had 24-hour care, and eventually she died in her home. But I knew at the end of that journey that everything we had done to provide her the safety and the resources that she needed to stay at home was well worth the journey of all the challenges, of all the resistance, because we knew that she was in a safe environment and that the quality of care that she received was far greater than what she would have gotten had she been removed from that home. So that's one of the best parts of being a care manager, is that at the end of the journey, despite the challenges, you know that you've made a true difference in somebody's life.